Hi, everyone. I'm Dr. Jennifer V. Brown, your stroke specialist. I'm aging gracefully with stroke due to sickle cell disease. And today we're going to discuss why scooting is good for walking. So, when you do something called unilateral scooting, your pelvis rotates forward. You have to unweight it on one side before you rotate it forward. When you rotate your pelvis forward, when your knee is extended, it leads to a longer step length. Also, when you do this unilateral scooting, because your trunk is shifted to one side, you have to have a dynamic but stable trunk, meaning your muscles are turned on so that you're upright. You also need this posture when you're walking. Let's look at the video for unilateral scooting. Notice the pelvis comes up and then it's rotated forward. And then you load that pelvis, you shift again to one side, rotate that pelvis forward, lower it down, and the repeat. So I also do some isolated things at the pelvis itself in different directions. Anterior, elevate the pelvis, but posterior depression. I'm trying to work all of the muscles that surround the hip joint and the pelvis. So we'll look at that first, and then we'll look at posterior elevation and anterior depression.
Okay, so this is another pelvic motion in which the movement is up and in for the anterior portion of the pelvis. So let's move your pelvis up
So the
and
pelvis moves
in,
up and
move it up
in,
and in, and then go down and back.
and then down and back.
Down. Look at the lengthening
So
that occurs
anterior
here. Go
elevation,
up and
posterior
in, elevate it,
depression.
and then go down and back.
And notice how I apply the resistance with my
And that's it.
hands. This now is posterior elevation and anterior depression.
Pelvic motions, we're going to go up and back, but down and in. Alrighty? So the cue is push up and back into my fingers, up and
Push
back,
up
up and
and
back,
back
up and
into the
back,
hands,
release. Then come
but push
down and forward
forward
into the
and
heel
down
of
with
my
the
hand.
pelvis.
Excellent.
And
Up
that's
and
what
back,
you do
up
really
and
to
back, up and back,
initiate the
up and back,
pelvis
and
rotation
then down
and the
and forward into
release
the
of the
heel of
hip
my
so that
hand.
the knee
Excellent.
bends
You can
right
stop.
before you really start this forward rotation during the rest of swing phase. These are some clinical questions to ask. Is there adequate static and dynamic trunk balance in sitting with or without the use of the arms? Is there adequate lower trunk and pelvic range of motion, multiplanar, including at the hip joint? And this is why I like that anterior elevation, posterior depression, or posterior elevation and anterior depression. And then I really start the rotation components. Is there active weight shift in the frontal, meaning this plane, because your trunk has to come forward, and then in the transverse plane, because that's the rotation component? And last, is there adequate muscle strength of the trunk, pelvis, and lower extremity? Don't forget, I am your trusted source for all things ankle foot orthoses and stroke neurorehabilitation. Scan the QR code and go to my website. Send me an email. I'll respond. The book is on sale. You get so much information on what to do as a physical therapist for the examination and follow up for what should be done to make the best fitting and functioning ankle foot orthosis. And don't forget about the references. We have to use evidence based practice to improve the health outcomes of the people that we serve. Thank you so much for watching this video. Bye.